Are we missing the mark when it comes to neck rehabilitation? As a doctor of physical therapy, strength conditioning specialist, postural asymmetry guru, and someone that suffered with chronic neck pain, I believe I'm in a unique position to offer a resounding yes as an answer to that question and to give you my unique perspective. So we're going to talk about this from two standpoints here. First, from a more general perspective, looking at rehab and how rehabbing the neck and rehabbing other parts of the body is seen as different. And then we're going to talk about this from a postural perspective as well. And in the end of the video, we'll get to some sample exercises that you can use to get some results. So let's go ahead and jump right in. All right, so first of all, let's think about what rehab means, right? Rehabilitation is getting someone back to a prior level of function. That's what'll come up if you go on the internet and go, oh, Oxford Dictionary, what is the definition? But within that word or that phrase, prior level of function, there is a little bit of nuance. And that nuance is the prior level of function just being able to complete the tasks you used to do, right? And usually what that looks like is I used to walk without pain, then I had neck pain, and now I walk again without neck pain. All right, so yeah, prior level of function in some respects. But we could zoom in a little bit closer and say, well, wouldn't prior level of function mean with the same endurance, strength, coordination, and position? And I think if we look at it through that lens, we can say that neck rehabilitation misses the mark. Now, why is this? I think a lot of this stems from underlying fears that we have as providers. So we look at the research, they say that chin tucks or head lifts are good for developing endurance of the deep neck flexors. And then we avoid other motions like side bend and extension because we feel that there are sensitive structures in the neck like nerves and vessels that we don't want to mess with. So we don't actually use those motions a whole lot outside of the context of just stretching, and we definitely don't progressively load these like we would any other area of the body. So think about this for a second. If we were to look at your hip, and we say that we have flexion and extension of the hip, we have outward movement of abduction and inward movement of adduction, we have external and internal rotation. If you go to rehab a hip, you're going to do all of those motions and you're going to progressively overload those motions or exercises that include those motions over time. You contrast this with the neck, we're usually avoiding the lateral flexion, we're usually avoiding the extension, we're usually avoiding combined extension, lateral flexion, and rotation, and we're certainly not overloading those movements. Now, the big problem with this is we have a number of muscles in the neck that help us to achieve positions of the head and neck with respect to the rib cage, as well as influence our ability to balance that rib cage. And many of those muscles are going to be involved in the motions of lateral flexion, extension, and rotation. So if the only thing that we're doing to work on those motions is just doing stretches or gentle active range of motion, then we're really doing ourselves a huge disservice. We would never do this for any other area of the body. So why, aside from fear, do we do it for the neck? So I think a lot of this is fear-based, and if we can move past that, then we can simply treat the neck like any other part of the body and work with it progressively to the tolerance and based on the response that we're getting from the body. All right, so now with that said, I think the second biggest missing link is not understanding how the postural system and the neck interact. And specifically, I think we don't understand how the position of the body below the neck impacts the position of the neck. All right, so to help me demonstrate this, I got my buddy Mr. Phibbs, and what I want you to see here is that I'm gonna keep Mr. Phibbs' head in neutral, and I'm gonna move this rib cage. And I want you to pay attention to the movement at the neck. So if I bring this rib cage down on the right and up on the left, we're gonna start to see that the neck acquires this position of moving to the left. And if I go down on the left and up on the right, it acquires a position of going to the right. Now, a lot of times we don't respect this. And so we'll see someone that looks relatively symmetrical, but if we looked closer, they actually have one shoulder lower than the other. And we have a neck that's chronically held in one position more so than the other. So if we go to work with this person and we go to flex this neck forward, backwards, side, and side, what we're really doing is we're just reinforcing the pattern of having a neck on a rib cage that's in this kind of position. Now, there's nothing necessarily wrong with that, but if we could take into account the influence that that rib cage was having on the position, then we could work a little bit more symmetrically and provide some context as to why certain motions might be blocked more than others. For example, if we had a rib cage that was really, really low on one side, then we might be holding this neck in a lengthened position, and some of those muscles might test as being a little bit weaker. Now, on the flip side, we might have this side of the neck in a really tensed and closed down position, and doing neck stretches to the side might help to alleviate that temporarily, but when we bring it back into midline, because we have this position of the rib cage, we're just gonna compress that side once again. A more effective way to actually work with that might be to restore some dynamics of the rib cage to open up that position being symmetrical side to side because the body underneath is in a better position. All right, so now to get into the exercises, we really have two broad categories here. On the one hand, we're gonna deal with what I just talked about, which is developing some awareness of how the rib cage, neck, and head interact from a positional perspective. Then that second category, which we're gonna get to in a second, is gonna be direct neck work to work on the actual muscles of the neck and the motions that are performed by the neck. So let's go ahead and we'll dive into independence first, and then we'll get to strengthening a little bit later. So the first thing I do, and we can really integrate this concept into any movement that we do, is to gain some independence between the head and the rib cage. And the easiest way to start with this is to simply get your head into a stable midline position. So kind of look at the level of your ears. Are they even? Hopefully they're even. You can put your hand behind your ears, kind of sense those knobby parts of your head. Okay, that's even. And then from here, we can simply practice moving the rib cage slightly to one side, back to neutral, then over to the other side. And for most people, there's going to be a side that's a little bit easier to come into and a side that's a little bit harder. For me, it's a little bit easier to bring my rib cage over to the left, keep my head in midline, versus if I try to bring my rib cage over to the right in midline, I get some nice cracks and pops. It actually feels pretty nice. But there's a tendency to want to move that head over to the right with that. So we can simply practice this by just doing this kind of a movement. So coming down on the right, up on the left. And I'm really doing this by moving my rib cage, not my shoulders. Then going up on the right, down on the left. As I'm going up on the left, down on the right, I'm shortening the left side of the neck and elongating the right side. And then as I go up on the right, down on the left, I'm elongating the left side and shortening up that right side. Now we can also put that rib cage in neutral and get a feel for just the direct motions of coming to the side like this and to the side like this. And again, we'll usually have one that's a little bit easier than the other. So for me, when I go to the right, it's a little bit easier. When I go to the left, it's a little bit more challenging. And oftentimes what we'll find here, if we have that difference, is a difference in precision of motion between sides. And so a lot of times what we'll do is on one side, we'll bring the ear down and kind of easily close like that. But on the other side, we might be failing to just pull that ear down and instead kind of orient the whole head as a unit. So we want to get really precise with this. Think about pulling your ear down on one side, up on the other. Think about squeezing those vertebrae together on one side, as well as the other side to kind of open. And then we're going to reverse that back to the other side and simply get some awareness of when the neck stops moving and when that rib cage starts moving. Once we can be able to do this motion of moving the neck side to side without the rib cage moving and move the rib cage underneath the head without the head moving, now we've developed enough baseline level of rib cage and head independence, and we're ready to go on to more direct neck strengthening work. So let's go ahead and we'll dive in a little bit there. And I've got a cool little tool that I've been using that I just can't wait to show you. So let's go ahead and check those out. If you're getting value from this video so far, consider subscribing to the channel if you haven't already. Leave me questions down below in the comments, and like and share this video. All right, so when it comes to moving the neck, we have 6 motions available. We have flexion, which is bringing the head down. We have extension, which is bringing the head up. We have side bend to the left, side bend to the right, rotation to the left, and rotation to the right. For this particular video, we're gonna go through flexion, extension, and side bend to the left and right. We're gonna leave rotation alone for now. Now, there's really no right and wrong way to do this, but remember, one of the missing links that we had in our approach to rehab was our tendency not to want to load and progress these movements. So regardless of what movement we're working with, we want to be able to gear this towards something that's going to be against gravity and that can eventually be loaded. So initially we're going to go through these motions in just an against gravity type of setting without any additional load. So let's go through flexion, extension, and side bend here, and then we're going to talk about how we might progress this by adding a little bit of load. So the first progression I like here for flexion is just laying back in a hook lying position like this, and then starting to think about getting segmental flexion from the top of the neck down. And to do this, what I think about is taking the head, rotating it down by tucking the chin and head down and back a little bit. And then from here, I visualize one segment at a time from top to bottom, coming down, curling up, holding for a second at the top, and then coming down. I'll do an exhale through the nose as I come up. Inhale on the way back. Exhale up. Inhale back. Now, once we've got that flexion happening, we're going to start to go to extension. And we're going to apply a similar type framework here of moving one segment at a time. So I like to start here in this kind of prone on elbows position, which is an easy entry point for loading. But if you want to get a little bit more advanced, you could go fully prone with your head hanging off the side. From here, I'm going to think about bringing that head and upper vertebrae back into extension first. Then I'm going to continue down one segment at a time, coming up, exhaling through the nose as I do this. And then returning. Awesome. So now that we have flexion and extension going, we should be able to get the head to reasonably be in alignment with the rib cage front to back. So my head shouldn't be way out in front of the body, and if it is, I'm just going to gently pull it back so it's positioned over the rib cage. Now from here, we want to get a visual appreciation for where the rib cage is at. So we don't want the rib cage crunched down or hiked up. We want the shoulders to be relatively perpendicular to the table or floor or whatever support surface you're using. Then from here, we're going to think about taking the ear of the top side and pulling it towards the clavicle as we exhale and maintain that squared up shoulder position. We're going to hold a couple of seconds, inhale as we come back down, and repeat. And again, as we're doing this, we're thinking about squeezing one vertebrae at a time from top to bottom. We're going to keep that rib cage up close to the ear on that side. What we don't want to do is have everything crunch up as we're coming up, because that's the neck not moving and actually just moving here at the torso. So we want to stabilize the torso there. Exhale as you bring that neck up. Hold a couple of seconds at the top, and then come down nice and easy. Exhale up. Inhale, return. Exhale up. Inhale, return. All right, so now that we've got those basic movements down, we need to find a way to load these. And I think one of the reasons that we don't load the neck is because there's really not a lot of good tools out there. Well, I think that one company in particular has solved this problem. I haven't got all their products yet, although if you're watching this video, send me the other one that I'm not going to show. But one of their products in particular, I think, is a great entry point to start to be able to load the neck. And this is a product from the Iron Neck, which I think is just their basic level, or I don't know what it's called. I actually don't know what it's called. But it's really great. It's a harness that goes around your head. You can attach free weights to it, and you can go through some of these same motions. So we're just gonna go through a couple here to kind of give you a flavor of what I would do and how I would set these up. But I think you can integrate these into some of your neck strengthening, and just like any other exercise you might be doing in the gym, you can progress this by a pound per week, or every 2 weeks, or half a pound, and see what works best for you. And really make sure that over time, you're not only improving your positional competence, but also strength, endurance, coordination, proprioception, all those other things that go into good, long-lasting, sustainable, sticky rehab. So let's go ahead and jump in. First here, just looking at using the iron neck with flexion and extension. All right, so to kind of get this going, we need to attach this harness. So the iron neck part goes in the front, and then there's gonna be a hook in the back and a chin strap as well. So we're gonna put this on, and then we're gonna take that hook, secure it in the back. And you do wanna get this thing to be fairly tight front to back. Okay, try not to rip any hairs out while you do it. Okay, and then from there we can tighten up that chin strap a little bit. I find that I don't want to tighten this as much because it does feel like it restricts the breathing a little bit. But then once I'm locked in, there's kind of a goofy feeling, then I have this strap here which I can attach to these hooks, and I can hang a weight. So I'm going to hang just a 5-pound weight to start. You could start with anything as light as 1.25 pounds or 2.5 pounds. But right now I'm working with 5. 5 is a really nice sweet spot where I feel like I get good movement quality. But after a number of reps, maybe about 15 or so, I do get a decent burn going in the neck as well. All right, so we're gonna hook on here to these hooks. Okay, and then the most simple one you can do is to center the weight in front of you. And we're simply going to, from here, allow that weight to come down as we're bending the head. And then from here, we're gonna go up one segment at a time. And I'm probably gonna maintain just this normal kind of hunched position like this as I just extend the head up on top of the rib cage. Now, as I'm doing this, I can actually sense the pressure in my right and my left side, and depending on where I've got my shoulders, I'm either gonna have even pressure, more on the left or more on the right. So I feel like a little more on the left, I'm gonna shift over to the right, it's gonna square the shoulders. Now from here, I can superimpose that active motion on a more neutral rib cage. Excellent. I feel a little bit more activation now on the left compared to what I was getting before. That's a bit of a weak spot for me, so this is feeling quite great. And that's a nice way to isolate the neck. Now, if I want to take this to the next level, I can start by using some variations that are actually going to have me in a little bit straighter of a position with my neck hanging off something like a table. It's going to make me work a little bit harder. So we're going to do that now for extension as well as lateral flexion. All right, so here we're just hanging off the edge. And even just this as a beginning progression could be good for a lot of people that haven't done direct neck work. It's just an isometric hold. But then from here, again, we can apply the same concepts of one segment at a time, coming up, holding for a few seconds, and then coming down. Once again, I adjust the shoulders as needed, come up, and then come down. The nice part about being at a deficit here is, especially if you have something high enough, is you can then hang down a little further, get a little more range of motion, a little more stretch on the back of the neck, and then come up. Really milk that full range of motion. And here at the top, you can start to get the upper back involved a little bit once you get the feel for the neck reaching its end range. So we're coming back, this is all neck on rib cage. Then here the rib cage kind of starts to move a little bit as well. All right, for this last exercise, I like to position this strap here to be over the top of the head. I find that this actually works the best. I did try a number of other setups, but I like this one the most. Now we're gonna go back to our cues from just a second ago, where we talked about making sure we're leveling off those shoulders first, so allowing this rib cage to lift, and then from there, really isolating that neck movement, coming up, holding a few seconds, and then coming down slow. Coming up, holding a few seconds, and then coming down slow. We're using the cue of ear coming down towards clavicle, holding a few seconds, feeling really nice, even activation on all sides of the neck, and back down. And as we're doing this, we're thinking about keeping that head over the rib cage, nice and stacked position, good engagement on all the side muscles in a balanced fashion, front to back. As you can see here, I'm working pretty damn hard, getting a nice burn here. This is really hitting some old weak spots for me. And I'll just say that I've been doing this loaded this way for the last few weeks, and even with chronic issues, I'm noticing a huge improvement, not only in the neck, but also in the upper chest region, with my posture, as well as with my ability to breathe easily at rest. You just feel so good, I don't want to stop. All right, so that does it for this video. If you're interested in trying out the Iron Neck for yourself, I've got an affiliate link down below in the description where you can pick one up. As always, thanks a lot for watching. Leave me any comments below, and until next time, peace.